Hi, my name is Esther Brazoban from Section 4. I'm going to read Unit 1, Professional English in Use, Chapters 1 to 4. Chapter 1, Health and Illness. Asking about health. Health is the state of the body. When the doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness, disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. Not ill, fit, in good health, well, very well, fit and well, healthy. Ill, unfit, unwell, in poor health, poorly, not well, not very well, unhealthy. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases. For example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings. I was ill this morning. I felt unwell this morning. I vomited this morning. Patient says, I feel sick. Possible meanings. I feel ill. I feel unwell. I am nauseous. I feel to need to vomit. The combination, sickness and diarrhea, means vomiting and diarrhea. Recovery. When the patients return to normal health after illness, they have recovered. We can also say the patients made a good, full, or complete recovery. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. In speech, we often use the verb get to talk about change. Get over an illness to recover, get better to improve, get worse to deteriorate. If a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Traducción al español. Salud y enfermedad. Preguntas acerca de la salud. La salud es el estado del cuerpo. Cuando los doctores quieren saber acerca de la salud usual de un paciente, hacen preguntas como ¿cuál es tu salud generalmente? O ¿cómo es tu salud generalmente? Si tú estás en buena salud, tú estás bien y no tienes ninguna enfermedad. Si tú estás saludable, tú estás normal, estás bien y puedes resistir la enfermedad. Si tú estás en forma, tú estás bien y estás fuerte. Falta de salud se puede interpretar como no estar en forma, en buena salud, muy bien, en forma y bien y saludable. También enfermedad se puede interpretar como no estar en forma, no estar bien, estar en pobre salud, estar mal, no muy bien y estar insalubre, sin salud. Sickness es enfermedad, que el significado es igual a illness, que es padecimiento. Estos nombres son usados en enfermedades específicas, por ejemplo, la enfermedad del sueño y la enfermedad del viaje. Los pacientes hablan acerca de enfermedades cuando sienten vómitos y diarrea. Los pacientes dicen que se sienten mal esta mañana. Los posibles significados pueden ser que no se siente en salud esta mañana, no se siente muy bien esta mañana o que ha vomitado esta mañana. Que se sienten mal, los pacientes dicen, entonces los posibles significados pueden ser no me siento bien, no me siento muy bien, tengo náusea o siento que necesito vomitar. La combinación de enfermedad y diarrea puede significarse vómito y diarrea. Recuperación. Cuando los pacientes retornan a la vida normal después de la enfermedad, dicen que se han recuperado. También se puede decir que los pacientes tuvieron una buena recuperación, una recuperación completa. Si la salud del paciente está en retorno a ser normal, se dice que el paciente está mejorando. Lo positivo es que está empeorando. Cuando también se puede decir que la salud del paciente está mejorando o deteriorando. En el habla a menudo se usa el verbo get para hablar acerca de los cambios. Get over para recuperar, get better para decir que se ha mejorado y get worse para decir que ha empeorado. Si el paciente está mejor pero empeora otra vez, el paciente tiene una recaída. La palabra improvement se usa especialmente en condiciones como el cáncer, que es la remisión. Él se siente mejor de la enfermedad, se recuperó de la enfermedad muy rápido. 2 años después, ella tuvo una completa remisión. Complete the table with words from A and B opposite. The first one has been done for you. Noun, fitness. Adjective, fit. Health, healthy. Illness, ill. Sickness, sick. Make word combinations using a word from each box. Look at B and see a positive to help you. Complete remission. Feel sick. Get over. Poor health. Trouble, sickness. Complete the conversation. Look at B a positive to help you. Doctor, how are you feeling today? Patient, not very well. Doctor, how long have you been feeling sick? Patient, about a week. Doctor, what is your health like normally? Patient, very good. I'm usually quite fit and well. Doctor, what is the problem now? Patient, it's my stomach. Doctor, do you feel sick? Patient, yes. Doctor, have you actually been sick? Patient, not. Doctor, have you had any serious illnesses in the past? Patient, not. None at all. Choose the correct word to complete each sentence. Look at B and see a positive to help you. Her condition deteriorated and she died. Her recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. The patient made a full recovery. I have been in good health for months and feel very fit. I was a month before I got over the illness. This seems to be rather unwell. His diet is bad and he never exercises. Chapters 2. Parts of the body 1. Parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. They are shown in brackets below. Jaw, mandible, neck, shoulder, armpit, axilla, upper arm, elbow, back, buttock, wrist, thigh, calf, leg, chest or thorax, breast, stomach, tummy, abdomen, navel, umbilicus, hip, groin, inguinal region, knee, patella, kneecap, shin, limbs, main arm, upper limb or left, lower limb. The trunk is the body excluding the head and limbs. Referring to parts of the body. When the patient speaks about their problem, they often refer to a part of the body. I am having trouble with my hip, shoulder, or knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest? Do you get any pain in your stomach or back? Describing radiation of pain. A patient is telling the doctors about his back pain and the part of the body it radiates to. It starts in the back, then it seems to go into the right buttock and down the back of the right thigh or the knee. Capítulo 2. Partes del cuerpo 1. Partes del cuerpo. Las partes más externas del cuerpo tienen un nombre ordinario en inglés y un nombre anatómico. Los doctores normalmente usan el nombre ordinario en inglés cuando hablan con otros. En algunas excepciones, los doctores usan el término anatómico, como podemos ver en las siguientes palabras. 1. Mandíbula. 2. Cuello. 3. Hombro. 4. Axila. 5. Brazo. 6. Codo. 7. Espalda. 8. Trasero. 9. Muñeca. 10. Muslo. 11. Pantorrilla. 12. Pierna. 13. Pecho o tórax. 14. Seno. 15. Estómago o abdomen. 16. Ombligo. 17. Cadera. 18. Ingle. 19. Rodilla. 20. Espinilla. Las extremidades del brazo puede llamarse extremidad superior, o de la pierna puede llamarse extremidad inferior. El tronco es el cuerpo excluido de la cabeza y las extremidades. Para referirnos a las partes del cuerpo. Para referirse a la parte del cuerpo, los pacientes cuando tienen algún problema se refieren a la parte del cuerpo en general. Por ejemplo, dicen tengo un problema en mi cadera, en mi hombro o en mi rodilla. Los doctores a menudo necesitan preguntar sobre qué parte del cuerpo específicamente tienen el dolor. Por ejemplo, ¿tienes algún dolor en tu pecho? ¿Tienes algún dolor en tu estómago? ¿O tienes algún dolor en tu espalda? Describiendo la radiación del dolor. El paciente le habla al doctor sobre su dolor en la parte del cuerpo y a dónde llega. Por ejemplo, el dolor empieza en la espalda, entonces se va dentro de su nalga izquierda y baja hasta la pierna, desde la pierna derecha hasta la rodilla. Write the ordinary English word for the corresponding anatomical terms in the table using your medical knowledge. Look at A oppositive to help you. Anatomical term and common word. Abdomen, stomach, axilla, armpit, carpus, hand or wrist, coxa, hip, cubitus, elbow, mama, breast, nates, buttock, patella, knee. Complete the sentence using ordinary English words. Look at A and C oppositive to help you. A male patient describing angina pectoris. It's like a thickness across my chest and it goes up into my neck and into my left shoulder and down to left arm. B. A male patient describing renal colic. It starts in the loin and goes into the groin and down in the testicle. 3. Complete the sentence. Look at A oppositive to help you. Anatomical term and patient statement. Inguinal swelling. If got a lump in the groin. Abdominal pain. My little boy got a stomach ache. Periumbilical rash. If got some spot around my navel. Thoracic pain. If got a pain in the middle of the chest. Enlarged axillary nerve. There's a painful swelling in my armpit. Mandibular pain. If got a pain in my jaw. Complete the table with words from the box The first one has been done for you. Trunk, abdomen, chest, loin. Upper limb, elbow, arm, wrist, finger. Lower limb, leg, knee, thigh. Chapter 3. Part of the body 2. The abdomen. The main organs of the body have ordinary English names and doctors use these words. But when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example the pancreas, have no ordinary name. Pancreas, duodenum, gallbladder, liver, right kidney, left kidney, spleen, stomach. When doctors talk about the main parts of the digestive system, they use the words bowel or intestine, the small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctor might refer to the anus and rectum as the back passage. The chest, thorax, contains the organs of respiration and the heart. The main part of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes and the right into 3. The airways consists of the larynx, the trachea or one pipe, the right and left bronchus, and bronchioles. The chest is separated from the abdomen by the diaphragm. The pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the uretra to be outside. Unidad 3. Partes del cuerpo 2. El abdomen. Los órganos del abdomen tienen un nombre ordinario en inglés y los doctores usan esas palabras. Pero cuando el adjetivo necesita un uso anatómico de la palabra, por ejemplo, ellos pueden decir enfermedad del hígado o enfermedad hepática. Algunos órganos abdominales, por ejemplo el páncreas, no tiene un nombre ordinario. Páncreas, duodeno, vejiga, hígado, riñón derecho, riñón izquierdo, estómago. Cuando los doctores hablan acerca de las partes del sistema digestivo, usan palabras como bowel o intestine. Por ejemplo, small intestine para referirse al intestino delgado o small bowel. También the large intestine o the large bowel, que sería para referirse al intestino grueso. Los doctores hablan con los pacientes, se refieren al anus como el pasaje trasero. El pecho o el tórax contiene los órganos de la respiración y el corazón. Las partes del sistema respiratorio son las vías aéreas y los pulmones. El pulmón izquierdo está dividido en 2 lóbulos y el derecho en 3. Las vías aéreas consisten en la laringe, la tráquea o windpipe, el derecho, los bronquios y los bronquiolos. El pecho está separado del abdomen por el diafragma. La pelvis. El doctor explica la función de la vejiga al paciente. La vejiga está situada en la pelvis. Esta se conecta con el pulmón por un tubo largo llamado uretra de un lado al otro. La uretra transporta la orina de los riñones a la vejiga. Cuando esta está llena, usted decide cuándo vaciar la vejiga. Cuando eso pasa, cuando la vacían, la orina pasa por el tubo, baja por el tubo que el tubo llama uretra y sale hacia afuera. Label the diagram using words from the box. Look at B or positive to help you. 1. One pipe. 2. Lung. 3. Lobes. 4. Diagram. 5. Airways. 6. Heart. 7. Bronchioles. Match the conditions 1 to 8 with the organs affected A to H using your medical knowledge. Hepatitis, liver, pneumonia, lung, nephritis, kidney, gastric ulcer, stomach, cystitis, bladder, angina pectoris, heart, cholecystitis, gallbladder, ulcerative colitis, large bowel or large intestine. Complete the text box struck. Look at A and C a positive to help you. Examination of the abdomen. To examine the patient for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the fingers upwards and inwards. Next, feel for the right kidney and the crossover to the other side to the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which in only feel if it is full. Chapter 4. Functions of the body. Eating. You're hungry. You're in a restaurant and the waiter brings your food. You smell it. It stimulates your appetite. You want to eat. Your mouth waters, filling with saliva. You take a bite of the food. It tastes good and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you've eaten. Something has disagreed with you. The 5 senses. In addition to smell and taste, the senses include sight or vision, hearing and touch, also called sensation or feeling. To text about the senses, doctor used the question, what is your sight like? What is your hearing like? Is your sense of smell normal? Is your sense of taste normal? To ask about the sense of touch, doctor asks about numbness, loss of sensation. Have you noticed any numbness in your fingers or toes? Other functions. Functions. Speaking. Verb. Speak. Noun. Speech. Function. Walking. Verb. Walk. Noun. Gait. Breathing. Respiration. Inhale, breathe in, take a break, inhale, breathe out, now breathe. Function, urination, micturition, verb, urinate, micturate, pass urine, pass water, noun, urine. Function, defecation, verb, defecate, pass faces, pass stools, noun, faces, stools. Function, menstruation, verb, menstruate, have a period, noun, menstrual, period, monthly or period. When taking a history, doctors can ask, do you have any trouble walking? Do you have any difficulty breathing? Do you have any problem passing urine? Do you have any problem with your speech? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Less common functions. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat more than usual? Do you shake more than usual? Introducción. Funciones del cuerpo. Comer. Tú estás hambriento. Tú estás en un restaurante, estás esperando a que te traigan tu comida. Tú la hueles, estimula tu apetito. Tú quieres comer. Tu boca se hace agua y sientes la saliva. Tomas un mordisco de la comida y sabe bien. Entonces lo masticas y lo tragas. Comes más, pero te sientes que sabe algo mal y sientes náuseas. Tú vas al baño y te quedas allí un tiempo antes de vomitar toda la comida que tú te habías comido. Algo te cayó mal. Los 5 sentidos. Además de oler y saborear, los sentidos incluyen ver o la visión, escuchar y tocar. Para recibir respuestas acerca de los sentidos, los doctores usan la pregunta de cómo está tu visión, cómo está tu oído, tu sensación de oler está bien, tu sensación de oler está normal. Para recibir respuestas acerca de los sentidos, de tocar, los doctores preguntan acerca de la sensación o el adormecimiento, la pérdida de la sensación. Si has sentido algún adormecimiento en tus dedos o dedos de los pies. Match the symptoms 1 to 5 to the question A and E using your medical knowledge. Dysuria. Do you have any pain when you pass water? Dysphagia. Do you have any trouble swallowing? Diplopia. Is your vision normal? Dysphagia. Do you have any difficulty with your speech? Dyspnea. What is your breathing like? Patients are describing symptoms of the condition shown in brackets. Complete the sentence. Look at C and D opposite to help you. If got pain and numbness in both feet. Peripheral neuropathy. I am having difficulty swallowing solid food. Esophageal stricture. I have a lot of problem passing urine. Prostatic hypertrophy. I've been sweating more than usual, even when it's not hot. Hyperthyroidism. I've noticed that my hands shake when I'm not using them. Parkinsonism. I have trouble breathing when I climb to the stairs. Left heart failure. Complete the sentence. Look at B, A, B, and C and D opposite to help you. When I eat solid food, I have to chew it for a long time before I can swallow it. Do you have any pain when you pass stools? Do I have no appetite and I've lost 5 kilos in the last few weeks? When do you have a period? The garden is full of flowers, but my sense of smell has disappeared and I can enjoy the perfume. Take a deep breathing.